Do you know someone who has a substance use problem? Do you believe prevention works? North Country Health Consortium believes that reducing substance misuse improves the health status of the North Country region. That's why our focus is prevention. That's why we do what we do. We know that we can reduce risk for substance misuse by changing social norms of acceptance for substance misuse and reducing stigma around substance use disorder. We know we can strengthen protective factors by promoting community and partner engagement, and at the same time encouraging healthy activities. We also know that increasing awareness at the local level regarding the true risks associated with substance misuse and finding proven ways to support these concerns is essential for success. Let's hear from some of the community-level faces of prevention in North Country communities to learn more about what we mean.
Hi, I'm Casey Reagan. I'm a junior at Woodsville High School. Having youth involved in the conversation about prevention is beyond important because we need to help influence and update the conversation to make sure it stays on track. We know best about how to reach out to our peers. Plus, we are the ones who are going to inherit this crisis, so we need to be involved in the conversation now. So one, we can better fight it when we have more opportunities and when we're older, and also so it becomes something that we still believe is worth fighting for even as we age. I've had a lot of great opportunities thanks to the coalition and the consortium. Because of them, I've spoken to Jean Shaheen and her team twice now about the vaping crisis, as well as other elected officials. I've been able to join the Governor's Youth Advisory Council, and I helped to host a forum for the Legislative Youth Advisory Council last year about substance misuse. Because of the coalition, I've been empowered to continue to fight and do whatever I can to help in this issue, and I've received nothing but support. I've learned so much, and every day I do something, I'm learning more.
So, a law enforcement perspective to how we interact with the community is pretty unique because obviously we have to enforce the rules and regulations and the laws of the state of New Hampshire and our communities, but enforcement itself isn't the only way to fix problems. And our approach, at least in my department, is that we want to peel back the layers and have more of a collaborative approach. And that's why we work very closely with North Country Health Consortium so that we can be part of that problem-solving approach within the community and working with the other partners. Some examples would be recently we know that certainly we can't arrest our way out of our drug epidemic, and prevention and education are big tools that we use in order to keep people better informed, but also hopefully reduce the amount of recidivism as well as trying to prevent people from becoming addicted to drugs. And if they are addicted, then our approach is we want to help them. And ultimately the goal is to reduce the crime rate and to make people better citizens and make them better community members. We also work with the Health Consortium to recently officers are going to be trained as recovery coaches. So when people come here and they're in need, we know how to get them help, where the resources are, and to help counsel them into wellness.
I'm Sean O'Brien, the lead facilitator for Youth Leadership Through Adventure. Youth Leadership Through Adventure has a proven track record of building leaders throughout the years. These leaders go back to their schools and their communities, and they're a positive role model for their peers and even for adults in their building. And they make change. Even without our guidance, they're going on to colleges and universities and doing similar work to what they've done with Youth Leadership Through Adventure. Youth Leadership Through Adventure has leaders that are already proven leaders in their schools and communities, but we also have students that are on the edge of leadership or might be at risk. And we work with those students to give them the tools that they need by using positive youth development and helping them to be a leader for good.
Hi, my name is Mark Bonta. I'm with Genfit America in Littleton, New Hampshire, and I'm also on the State Advisory Board for the Recovery Friendly Workplace Initiative. The reason I got involved with the initiative is because I can identify with it for a couple of reasons. I've been a nicotine addict all my life, so I know how difficult addiction can be, and I know how difficult it is to quit. And also, about 10 years ago, I had an employee that was coming to work smelling like alcohol. When we did a breathalyzer test on her, she blew legally drunk. And at the time, I felt like I didn't have any other choice but fire her, which I did. Well, within 6 months, she had drank herself to death. So it makes me think today that if we had the resources available and the options available with the Recovery Friendly Workplace Initiative that we have today, maybe that employee would still be alive today, and maybe she would still be working for us.
Our diverse array of prevention programming has us uniquely positioned to implement a more comprehensive prevention-based approach for addressing the challenges many of our North Country communities face. Prevention programs in the North Country being coordinated through our North Country Prevention Network allow us to be more effective at integrating programs and delivering services. While strategies can vary from community to community, local input is critical. Effective, evidence-based prevention saves lives. These are some of the reasons why the North Country Health Consortium has been chosen as the New Hampshire Providers Association 2019 Prevention Provider of the Year. By the way, if you're wondering who I am, my name is Lucy Bree. I'm 18 and I live in Whitefield. I'm a voiceover artist and mental health advocate who believes raising awareness is necessary for a healthy community. I've struggled with my mental health since I was in the 4th grade, and I've been in therapy since I was 13. I've had my fair share of teen hardships. And for me, prevention is of the utmost importance. Think about what you can do in your community to impact prevention. To learn more about prevention in your community, you can visit our website at nchcnh.org or call the North Country Health Consortium at 603-259-3700. Thank you.